also mention if there's scar tissue. Well, scar tissue is a funny term because that's how things heal, is with scar. But if they heal properly and the scar is mature, and it may take 6 months to a year for the scar to mature, then you've gotten rid of the problem as long as you have a good normal uterine lining. And you should have no problems implanting and having a normal pregnancy. Now, on the other hand, what if you've had multiple operations already and the fibroids keep coming back and they're impinging on the lining? Well, then it can be very problematic or difficult to try to fix that. Because there will be too much scar and there really won't be normal uterine tissue. So I think it's very important. The very first myomectomy you have should be done by someone that really knows what they're doing. And the FDA doesn't approve of laparoscopic or robotic myomectomy. We can do it with a small open incision and absolutely be perfect about getting every fibroid, not leaving anything behind. And we inject then the incision with a long-acting local anesthetic that lasts 2 or 3 days. So you don't really have much pain at all from this. But with an open myomectomy, there's no risk of spreading cancer cells. And that's why the FDA recommends open. But also, even the smallest fibroids, we can actually feel that with our surgical fingers and not miss them the way you would with a robot or a laparoscope. So although certainly prostatectomy and hysterectomy can be done extremely well laparoscopically or robotically, and preferably for a myomectomy, you have to have that feel. And you don't want to risk spreading cancer cells, so it should be done open. So if it's done right, there should be no problem having pregnancy. But what if you have a terrible myomatous uterus filled with fibroids and have been operated on many times already? Well, if the uterine lining is okay, you'll still be okay. But if the uterine lining is not okay, then you really ought to go to a gestational surrogate. And we're very lucky in this country, in the United States, that it's totally legal. Gestational surrogacy is legal, and there's 20,000 women that love being pregnant but don't want to have any more children than they've already had. And so we can easily find a gestational surrogate. And that would be a preferable thing to trying to operate on a fibroid uterus that's had multiple failed surgeries already. So either way, we should be able to get you a baby. That shouldn't, your fibroid should not interfere with your having a baby, no matter what.